Welcome to Cherok Chiropractic Office. I'm Dr. Nicole Cherok, and I've been practicing in our community since 1985. During that time, I've made it my mission to become a specialist in methods that my patients can use to improve their health naturally without unnecessary drugs or surgery. Chiropractic is one of the principal methods I use. The type of chiropractic I use is Activator chiropractic, which is one of the safest, most effective, and gentlest methods available. There's no twisting, popping, or snapping ever with Activator chiropractic. In fact, Activator is the only chiropractic technique endorsed by Dr. Andrew Weil. In order to determine which therapies might be useful for you, I do a complete physical exam the first day the patient comes into the office. I also do imaging studies if necessary. A wonderful aspect of the Activator adjusting instrument is that I can adjust the force of the thrust for each individual segment. Setting it low, I can adjust smaller areas or smaller patients. Opening it full, I can adjust larger patients or areas of the body where there are larger muscle mass. This is a soft tech table which I have in my office. It's capable of raising and lowering a patient weighing up to 350 pounds. It makes it much easier to treat patients who are in severe pain because they don't even have to get up to or off of a table. The table does the work for them. A very important aspect of Activator adjusting is the leg checks. These diagnostic high-precision leg checks tell me exactly where to adjust each time the patient comes in, and also how the area is misaligned in three-dimensional space. For example, the pelvis alone can misalign 36 different ways. This is what a leg check looks like. I have the patient contract various muscle groups, and that tells me, because of the muscle attachments, what is misaligned today. Put your right arm across your low back, arm down, left arm across the low back, arm down, lift your right hip slightly, and down. Okay. This one is misaligned. That was the test for the third lumbar vertebra. I'm going to have the instrument full open for maximum force, and I'm going to adjust the third lumbar. The leg checks help me monitor the effectiveness of the adjustment because there's the before test and the after test. Greater evenness, more evenness in the legs tells me there's been an improvement in the functioning of the nervous system, and this correlates with improvement in the patient's symptoms. For instance, decreased pain or better function of an organ. Perhaps they have allergies. That was the nerve supply to the sinuses that I just adjusted. So once again, I'm looking for leg length inequality. Another wonderful aspect of Activator adjusting is that we can adjust not only the spine, but also areas beyond the spine. Because I'm advanced proficiency rated in Activator and have spent hundreds of hours studying, training, and testing in adjustments beyond the spine, I can treat very effectively jaw, shoulder, elbow, wrist, hip, knee, ankle, or foot problems. For example, I commonly treat carpal tunnel syndrome. Make a fist with your right hand and relax. Finding a misalignment in that area, I would adjust it. Hand up top, please. Arm back. Make a fist with your right hand again. Relax. And look for an improvement in the evenness of the legs. Oftentimes, allergies and sinus problems respond well to Activator adjusting. A part of the adjusting that I would do for that particular problem is the sinus area. Once again, with the Activator set to closed, I can use a very, very low force for that adjustment.
Yeah, as you can see, Dr. Cherok can treat you for a variety of different things. I get treated for my knees, my elbows, my back, and my spine. She's given me assistance with helping me sleep as well as my allergies. Overall, I would say that in the 5 years that I've been seeing Dr. Cherok, my quality of life has gone up tremendously.
Whether you want relief care or whether you want long-term wellness care, we are happy to design a program to meet your goals in my office.